New at 11, state investigators say a local mental health hospital doesn't provide a safe workplace for its employees. The investigation shows 30 cases of violence that left employees injured at East Tennessee Behavioral Health between the years of 2022 and 2023. One nurse died following injuries she suffered at work, 61-year-old Jan Allison. That nurse already suffered health challenges, but the autopsy report says her death was caused by complications from the hip fracture she suffered at work. The medical examiner ruled the cause of death a homicide, and tonight for the first time, 10 News reporter Vinay Simlad shows you the video that led to her hip fracture and ultimately her death.
To her family, she's an angel.
She was compassionate almost from the beginning.
A loving sister.
Our nicknames for each other. I was Little Savage and she was Ultra.
A mom who was always reachable by text.
There was always some sort of crisis, however minor. Sometimes it was shoe related.
Jan Allison met her husband Richard through mutual friends.
I thought she was beautiful and I wanted to be really careful to not screw things up.
5 years later, he says he struggles with losing the love of his life.
I've tried to focus on admiring her creativity more than mourning her loss, and that's been a struggle.
Investigators say on September 23rd, a Saturday morning, Jan Allison was working as a nurse at East Tennessee Behavioral Health in West Knoxville. Two patients were fighting. You see on security camera video, one of them takes his shirt off. As hospital employees step in, one of them runs at Jan Allison and pushes her to the ground. An ambulance took Jan to Fort Sanders Regional Medical Center with a hip fracture. State investigators say the hospital didn't have any on-site security on weekends. Staff weren't given panic buttons or communications devices. From 2022 to 2023, state investigators at Tosha say 30 staff members were injured because of violent incidents at the hospital. They say reporting those safety concerns to management would lead to reprisal. The state fined the hospital $6,000 and recommended they hire full-time security.
We think that maybe had there been security there or enough staff or protocols more thoroughly in place that she could still be here today.
After she fractured her hip, Jan spent a month at Fort Sanders. She never left.
Thursday morning, the 25th, her doctor told us that there was no way she would live.
Jan Allison's autopsy report shows after surgery she had respiratory failure, developed an infection, and had pneumonia before she died.
Doesn't seem like there's any repercussions for anyone involved with what happened.
Her family is left with memories of Jan at Pawleys Island, her favorite place.
So I hope she's happy, and I hope she's enjoying Pawleys.
Her sister uses this bell to remember Jan, her angel.
I hang it from my rearview mirror, and every time it rings, it's like, you know, like she's talking to me.
That was reporter Vinay Simlad. In a letter to the Knoxville Police Department, the District Attorney General's office says prosecutors couldn't charge the man who pushed Jan Allison because he was being treated for a chronic mental health condition. The letter says by law he couldn't have criminal intent. We've learned that man is now in a hospital in Middle Tennessee and now under a conservatorship. Meantime, the hospital's ownership group says in a statement to 10 News, inpatient psychiatric and emergency departments have the most recorded incidents of workplace violence in the medical field, due in part to the acute behavioral health needs of patients receiving care. They add they're working on adding de-escalation sessions and workplace violence prevention classes for staff members at the hospital. We did ask the hospital if they followed Tosha's recommendation to add more security at the hospital. They responded they have nothing else to add to the statement they provided.